improving the coordination of NDIS-funded supports. The NDIS aims to provide people with disability the support that they need. At its foundation is a principle of individual choice of supports and support providers, with some choosing one provider and others choosing several. Navigating the NDIS, making informed decisions and fitting multiple providers together in an NDIS-funded support package can be challenging. So how can NDIS participants, providers and the NDIA make sure that everyone is working together in a safe and quality manner for the person with disability? Funded by the Australian Research Council, researchers across 3 universities have been investigating the experiences of planning and receiving NDIS-funded supports. We asked 3 groups in southeast Queensland to be part of our research: NDIS participants, frontline staff and support coordinators, and service organisations and providers. We asked them everything from how they go about choosing and connecting with service organisations, what opportunities and challenges they experience to connect their supports, and where they see improvements can be made. And here are some of the experiences shared with us by NDIS participants. For participants, the increase in providers has allowed greater choice in how they receive their supports, but it is more challenging to manage lots of providers. There are also new risks for participants who now have to think more about the quality of providers, often with limited information. The role of a support coordinator was seen by many as a safety net for NDIS participants to help navigate the scheme, multiple providers and funding arrangements. However, concerns were expressed about skill and consistency of support coordinators, NDIS planners and LACs. Participants were often using a trial and error to find ways to make their supports and providers work together well for them, and ways to manage their plans well. And across NDIS participants and families, providers and government agencies, a lack of good communication and information sharing created confusion of roles and responsibilities. We also found that there are good examples of how to fit supports together well, so that they are working in a safe and quality way, as well as ideas from NDIS participants to improve their experiences. So what are some practical solutions? The NDIA should support the development of local information hubs, including online systems that provide clear and transparent information about the quality and availability of local providers, and provide a way to link participants in local areas so they can gain peer support. Provide more guidance and help to NDIS participants in selecting providers and enabling them to work together. Provide more practical support for NDIS participants to identify, assert, and resolve risks and concerns about support provision, including through funded disability advocacy, and invest in building the skill level and capabilities of key NDIS workforce participants, such as planners, LACs, and support coordinators. For more information on this project and the resulting detailed policy options, please visit our website.